The chair now recognizes for 5 minutes Ms. Velasquez.
Thank you, Mr. Chairman and Ranking Member. Gentlemen, it has been 6 months since this crisis began, yet new infections are still climbing in many states. Many hospitals are at capacity, and thousands of Americans are dying. I am concerned about widespread delays in test results are contributing to this problem. In Arizona, the test positivity rate is over 20%, but test results there have been delayed by up to 16 days. In Florida, many hospitals in the state are near or at capacity, but results can take over a week. In Georgia, some companies have reported average processing times of 5 to 10 days. Dr. Fauci, you said in a recent interview, and I quote, "If you're going to do contact tracing and the test comes back in 5 to 7 days, you might as well not do contact tracing because it's already too late." Dr. Fauci, if a 5-day testing delay is too long, then is it fair to say that a 16-day delay is absurd? What are the consequences from these delays?
I believe you can get a more detailed answer from Admiral Giroir, but as I said before, that is a delay that would interfere with the effective contact tracing, and we're trying to decrease that. But the exact numbers of the delay, I believe that Admiral Giroir has more precise information on that.
Yes, sir. Admiral. What are the consequences from these delays?
Yeah, thank you, ma'am. So as I talked about half the tests are done either at point of care or within hospitals, which are pretty rapid. The current data we have from the large commercial labs are that 59% of all tests are reported within 3 days, 76% within 5 days, and I am sure there's an outlier at 12 to 16 days because that happens, but that's very atypical. And in the cities you talked about,
sir, that is not what we are hearing from places like Arizona, Florida, and Georgia.
So I get the data every single morning from every single state and can tell you specifically what that is. And we have surge testing. We have brought federal resources to massively surge in Phoenix, and that's why it's totally gone down. In Miami, totally gone down. Jacksonville.
Reclaiming my time, Dr. Redfield, I would like to turn to you. Does the CDC have comprehensive information about the wait times for test results in all 50 states?
Sorry.
Does the CDC have comprehensive information about the wait times for test results in all 50 states?
I would refer that question back to the Admiral.
Sir?
Yes, we have comprehensive information on wait times in all 50 states from the large commercial
And do you
labs.
publish this data?
We talk about it whenever, always. I mean,
And you don't think that it will be important?
I was with 69 journalists yesterday, and we talk about that frequently. So if you would like to see that, I'm very happy to do that.
Well, it will be great so that those that are making decisions at the state and city level, we have access to that information. Because it is important to understand the trend.
They do. They have that information. In fact, from the commercial labs, when they place an order, they're told exactly what the expected wait time is for that order.
So we cannot expect to reopen the economy safely if the virus is spreading unchecked. Testing, contact tracing, and isolation will not be effective unless we cut the turnaround time for tests. And I don't want to talk about Puerto Rico. That's another story. Chairman Powell said this week that the path of the economy is going to depend to a very high extent on the course of the virus and on the measures that we take to keep it in check. He said also that the Fed will use its full range of tools to steer the economy out of recession. Gentlemen, is the federal government using its full range of tools to get the virus under control like other countries have? Many states are reconsidering their reopening plans after experiencing a shocking increase in new cases and being unable to stop the spread. Dr. Fauci, what roles does the lack of sufficient testing and contact tracing play in states' inability to control the virus?
Testing and contact tracing is one of a number of tools that are used to control the kind of surging we've seen. But I would also like to point out, Congressman Velasquez, to reemphasize again what I said in my opening statement, that we could do a really good job of controlling it if we paid attention to 5 fundamental principles, one of which is what we're doing here,
right,
with masks, crowds, distance, bars, washing hands. That is critical. Testing is absolutely an important part of it, and an important part of the process.
And I understand that, but the largest and most important pulpit is the one, Pennsylvania Avenue. It doesn't matter what you say if what you said is undermined by the President of the United States.
The gentleman's time has expired.